The frigid temperatures required to store the COVID-19 vaccines driving up the sales of dry ice. Channel 3's Caroline Corrigan tells us how one Chattanooga ice company is playing a crucial role in the distribution process.
Healthcare workers across the Tennessee Valley are finalizing plans for the arrival of the first COVID-19 vaccines. Katie Duffy is the Senior Director of Pharmacy at Erlanger Health System. She says one of the challenges is how they will store these vaccines.
We were instructed very early on by the Departments of Health and the companies not to purchase the sub-zero freezers or the ultra cold freezers because it will be shipped in containers with dry ice so that the temperature can be maintained.
So the hospital turned to Tennessee Valley Ice Company. Director of Sales Ryan Doolittle says most of their sales involved packaged ice in bags like this, which you would see at a gas station. He says they make up to 200 tons of this ice every day. But when they received the call from Erlanger, he says they were happy to help meet the need.
It's kind of neat, to think that we're going to play a small part in being able to provide a service to the community.
But this process came with challenges of its own.
From what we've been told, dry ice is hard to come by right now because of the CO2 shortage.
The shortage started in March when trucks stopped running routes due to the pandemic.
Imagine that, 2020, crazy year.
It resulted in a decline in ethanol, a key ingredient to make dry ice.
We actually had to change our supplier recently because our original supplier that we've used for years and years, they were struggling to keep us supplied.
He says they're traveling to Atlanta to pick up the dry ice Tuesday. They plan to drop off the first shipment, more than 5,000 pounds, to Erlanger by the end of the day. A crucial need to keep the vaccine stable once they arrive here in the Tennessee Valley. Reporting in Chattanooga, Caroline Corrigan, Channel 3 Eyewitness News.